Good morning. After the very interesting talk of Professor Bakopoulou, who tried to present us the biological base, at least the biological basis of smoking in adolescence, we will remain in this population. I'm going to discuss some aspects about the adolescent population, but more from a psychiatric point of view, some psychological and psychosocial aspects of the initiation of smoking in adolescence. I have no conflict of interest to declare. Smoking is a public health issue. Approximately 25 million adolescent boys and 13 million girls of the same age smoke cigarettes or use smokeless tobacco products worldwide. There are significant differences between countries. For example, a great study, the Global Youth Tobacco Survey, which included data from more than 100 countries, has shown that the highest prevalence of tobacco use among youth are generally in countries with non very high Human Development Index. In several of these countries, tobacco use among adolescent girls is now more common than among adult women, which may mean that we are expecting tobacco use, smoking in women to rise in the next years. In some countries, tobacco is now more commonly used by youth than by adults. Here is a world map based on the data of the previous study. And this variance between countries could be at least partly attributed to the implementation of anti-smoking policies. And I'm talking about the implementation, not only the existence of anti-smoking policies. And this is the case of Greece. Greece has launched some campaigns, but the implementation of these is still weak. Here is, on the other side, the example of Australia and the smoking prevalence among adolescents in this country. We can see that since 1997, when the first tobacco control campaign was launched, the prevalence has significantly decreased. In 2014, less than 1 in 10 adolescents in the US were smoking conventional cigarettes. In Greece, the same year, 37% of the in the adolescent population were identified as lifetime smokers of conventional cigarettes. 17% of the adolescent population in Greece has used electronic cigarettes, and most of them experimenting. But why does smoking in adolescence really matter? Apart from the recognized health risk factors, there is the transition to adulthood. Up to 19% of adult smokers started smoking before the age of 18. The duration of tobacco use has been recognized to be longer among those who start tobacco use at earlier ages than those who started later in life. And of course, the adverse effects of nicotine on the developing brain are well known by now. At an international level, there are increasing rates of electronic cigarette use among adolescents since its introduction in the market. In the US, electronic cigarette was introduced in 2007. In many countries, the use remains unregulated by national organizations with no restrictions on the sale to children and adolescents. And the overall impact of the e-cigarette use on public health remains uncertain. A lot of students, pupils, have reported they have used an e-cigarette. 13% of US high school students have used e-cigarettes in the past, during the past month. In Southern California, 1 in 4 pupils had used an e-cigarette. 1 in 10 identify themselves as current users, and almost half of them, the half of current e-cigarette users, had never smoked a conventional cigarette. We can talk about the emergence of a new public health issue. The various studies, like those here, report higher rates of current e-cigarette use than conventional cigarette use. There is an upward trend in e-cigarette use and a decrease in current cigarette use among adolescents during the last years. Trying to explain the e-cigarette use and perhaps also to form some preventive policies, 2 theoretical models have been developed, and they are contrasting. According to the first, youth who try cigarettes tend to have more conventional and health-orientated values. According to the second, on the other side, e-cigarettes may appeal to youth for reasons similar to those noted for alcohol or marijuana. For example, this could be the engagement in behaviors that provide pleasant physical sensations and increase positive mood, or act as a rebelling act against conventional values. Various studies have been designed and conducted. In a US cohort study among adolescents and young adults, the e-cigarette use at baseline was associated with progression to traditional cigarette smoking. In a longitudinal study among adolescents in the US, changes in expectancies, affiliations, and marijuana use were all significant pathways in the relation between e-cigarette use and smoking onset. What are the risk factors that are associated with initiation of smoking? What are the psychosocial risk factors? We're going to discuss them at 3 levels: at the peer group level, the family level, and at a personal level. Interestingly enough, product-specific psychosocial factors were stronger predictors for e-cigarette use than for the use of conventional cigarettes. First of all, the peer group. Peer pressure, peer approval, and acceptance have been identified as significant risk factors. Having friends who smoke is highly associated with smoking and intention for smoking. Perception of smoking as acceptable or normative among peers is also a risk factor. And very important is also the friend's attitudes, which mean what does the friend thinks about the smoking behavior of the adolescent. We can explore this thing, we can investigate this aspect by questions like, how would your best friend act toward you if you use tobacco products, for example? At the family level, as mentioned by Professor Lazzarato before, parental smoking has been associated, is a well-known risk factor for smoking in adolescence. And smoking disapproval, on the other hand, has been identified as an independent protective factor for smoking in adolescence. And what's more, low parental monitoring, which is, however, associated to parental smoking and other health risk behaviors, serves also as a risk factor. A number of socio-demographic and socio-economic factors have been also associated with adolescent smoking, like the divorce of parents, lower socio-economic status, and belonging to a minority group. At the personal level, curiosity, impulsivity, a number of conduct disorder symptoms, and the feel-good syndrome have been all correlated with smoking in adolescence. Beliefs regarding health, I'm going to discuss some aspects about that later, but also the history of disabilities, the history of learning disabilities, for example, with or without school failure, and the history of physical disabilities have been also identified as risk factors. Beliefs regarding health are very important, and we know that they are important since at least a decade before. Countries, it has been shown that in countries with a weak strength of beliefs about health, for example, beliefs that smoking is not good to health. In these countries, there is a greater decline there is a larger increase in smoking. So what I'm saying is that in countries with a greater decline in health beliefs, there is a larger increase in smoking prevalence among adolescents. Perceived vulnerability is also a very strong predictor of smoking behavior change. The susceptibility for smoking is also another interesting notion. Susceptibility is defined as an absence of a firm decision not to smoke. It precedes early experimentation, and therefore it is extremely significant. It has a predictive validity for smoking later in life. Regarding experimentation, it has been shown that baseline susceptibility is perhaps a stronger independent predictor than the presence of smokers among either family or the best friend network. Regarding progression to smoking from the experimentation level to smoking, then exposure to smokers may be more important than smoking susceptibility. And what are the psychological characteristics of these adolescents who start smoking? They tend to have lower self-esteem. They tend to be alone, and there are a lot of data showing that they may report emotional distress. Low life satisfaction in females was independently associated with e-cigarette experimentation in some studies, while emotional symptoms, conduct problems, and hyperactivity and inattention were significantly and independently associated with adolescents' current smoking. A lot of things remain uncertain. However, many studies indicate that perhaps there is a social environment more favorable to the use of e-cigarettes than to smoking cigarettes, and this raises concerns. For example, could the e-cigarette use lead to nicotine dependence in adolescents who would not otherwise have used tobacco products? These questions have also research implications. And for our unit, for the Community Mental Health Unit, the implication was the idea to design a cross-sectional study here in Greece. The aim is to investigate possible correlates of e-cigarette use among Greek adolescents, and more specifically, to assess the association of adolescents' emotional and behavior problems with various types of e-cigarette use, of course after controlling for socio-demographic and socio-economic factors. We are hoping and planning to recruit a sample of more than 2,000 pupils from schools in the metropolitan area of Athens. We're going to use some self-reported rating scales for emotional distress and other psychological symptoms. And who knows, we may present the results and discuss them in the next meeting. Thank you very much.